The first and most important rule in treating patients with HIV is ruling out resistance. You have to know which medications the patient is resistant and sensitive to. So once resistance is ruled out, we start the patient in 2 medications of the class NRTI plus 1 medication of the class integrase inhibitors. So the patient has to go back home with 3 medications that they have to take concurrently. Now these medications are more than sufficient to completely cure the patient, which means reducing the viral load to undetectable levels, which means if we take a blood sample and we test it for HIV, we will not see any HIV particles or HIV proteins at all. If the 3 medications fail to do this in 6 months, which means if the patient is strictly adherent to his medication, and still after 6 months we take a blood sample and we see viral components, we go to the second line, which is adding a medication of the intramembrane inhibitors or protease inhibitors or NRTIs. Now there's a small change in the guideline for pregnancy. If a patient is already an HIV patient and one day she got pregnant, she simply has to continue taking the same medication during and after pregnancy. But if she's just been diagnosed with HIV as she's pregnant, so we didn't know that she had HIV before or she didn't have HIV before, we have to start the first guideline without testing for resistance. So we start the patient in 2 NRTIs plus integrase inhibitor without waiting for resistance and sensitivity. Now, another very important rule for exams and exam makers is the drug zidovudine. Zidovudine is very effective in eliminating the risk of HIV transmission to the newborn. Zidovudine has to be taken intrapartum, which means during labor, and for 6 months after delivery. Elisa test is the main screening method of HIV. Basically, it will look for antibodies against HIV proteins and particles. Once it finds these antibodies, it will be positive, and we know that the patient has HIV. Now, in cases of pregnancy, it's a little bit different because the mother is already an HIV patient and she's already having these antibodies against HIV particles. So if you take a blood sample of the mother, the ELISA test will see these antibodies and will be positive. But in cases of pregnancy, these antibodies will transmit to the infant, but not necessarily the viral particles as well. So the virus might stay with the mother and might transmit to the infant, but the antibodies will definitely transmit to the infant. So if we take a blood sample of the infant and we subject it to an ELISA test, the ELISA test will see these antibodies and will be positive. Now we don't know whether the patient has HIV or not. We know that they have antibodies against HIV. So the ELISA test will be positive regardless of the infant's HIV status. This is why for the newborns we use the viral PCR, which is an HIV test that looks for the viral particles itself without looking for the antibodies. So in other words, for the infants or the newborn, we use PCR to look for the viral particles and not ELISA test.